Good afternoon, folks, and thank you so much for joining us again in our ongoing Returning to Work webinar series. Last week, many of you joined us for former Secretary of Health and Human Services and Utah Governor Mike Leavitt's presentation with our Executive Medical Director, Dr. Amy Kahn. And we got great feedback about that conversation and learned that it was helpful to you as you navigate the environment of reopening your businesses and returning to work to serve customers. This week, I am honored and exceptionally grateful for the opportunity to have Governor Brad Little and Director Dave Jeppesen here as our guests this week with all of you. Before we get started, I just thought it's worth pausing for a moment to call out what I think has been exceptionally strong leadership by the governor and his whole team throughout this pandemic. It has been an unprecedented series of demands, and as any of us who have served in government before will tell you, there is always a lot of options and a lot of choices about how to navigate that path, and always folks with lots of opinions and retrospective opinions about how to do things. I think the governor and his team have done an incredible job of moving us through this based on data, based on facts as we have them, and balancing the health of the economy with the health of our people. And I am proud to serve on the Governor's Idaho Rebound Committee and Dr. Amy Kahn on the Governor's Testing Committee to be a small part of helping the state move forward and reopen in a safe manner, but that also supports the economic health of our families and our households throughout the state. Despite all of the recent news coverage in the last few days in particular, COVID continues to be an ongoing concern for many of us as we return to work and the state reopens. And as you see here, we have, and you saw this last week as an organization, Regents has been focused on our members, our employers, our provider partners across the state, and importantly, nonprofits in the communities that we serve. This has been our North Star as we've moved through this as a company, as an organization, in partnership with the Department of Insurance and Director Dean Cameron, the governor's team, and other health payers throughout the state. We've tried to approach this as fellow travelers coming through this together. Couple housekeeping items. You might remember this from last week for those who attended. At the bottom of your Zoom screen, you're going to see two chat functions, a Q&A chat function and then one labeled chat. We want you to generate questions for the governor and the director over the course of this hour together. Like I said, this is a fireside chat. We want you to be engaged through this mechanism, but we ask you to channel your questions through the Q&A button. Otherwise, the chat button shows everybody everything all the time, and this helps our team organize the questions so we can get to them in a thoughtful and intentional manner alongside all of you. First, we're going to kick things off with Governor Brad Little, who, of course, needs very little to no introduction for the folks on this phone. But Governor, I will actually just say that this is a congregation of Idaho businesses and employers throughout the entire state, folks on the front lines, in the field, navigating reopening their businesses, not just CEOs of these companies, but also their human resource directors within these organizations. And your counsel and the director's counsel today and thoughts will be really helpful to them in continuing to understand and navigate the environment, like you said, balancing the health of people with the health of their businesses and the economy as we go forward. So, Governor, we're going to start with you. Director Jeppesen, we're going to bring you in a few minutes after the governor provides a bit of a overarching introduction and some questions. And then, Director, we'll chat with you for a few minutes, and then we'll have a three-way fireside chat together and field audience questions from there. Thank you so much for joining us. And Governor, I'd like to turn it over to you for just a few minutes for a broad overview of where you're at today and where you see us heading in the weeks and months to come.
Sean, thank you. Ever since I got this job, it's been a little frantic the last 80 days. Matter of fact, I joke that during the pandemic, it's like dog years. 1 year feels like 7 because there's so many things coming at us, particularly what's just happened the last 2 or 3 days. But my goal from the get-go was prosperity for all Idahoans, and particularly for our kids to have the option to want to stay here, to thrive here. And that takes a variety of issues: having a good job, higher income, but then all the other parts under it, taxes, regulation, cost of healthcare. Those are all factors in what it takes for Idaho citizens to thrive and to prosper here. But what's changed in the last 80, 90 days is 80, 90 days, I didn't have the issue of lack of consumer confidence. In fact, 80 or 90 days ago, what I had heard from businesses all over the state is couldn't find any help, that things were growing faster than they had capacity for, and so the challenges have changed. The goal is the same. It's for people to be prosperous. But as we look at that, and you addressed it, Sean, in your opening remarks, and I get that in this job all the time. You know, you're worried about healthcare and safety. You're not worried about the economy. They are not at all mutually exclusive. The businesses that you have on this call know full well if their employees or their customers don't have the confidence to either patronize their businesses or deploy capital, things come to a grinding halt. Consumer confidence in Idaho was almost at an all-time high 80 days ago. We were about ready to announce record high employment, and now we got record high unemployment, and it happened at a startling rate. I'm on the call probably once or twice a week with other governors. I was on a call with them yesterday, well, twice yesterday, 2 different groups of governors, and unique to Idaho at all. But the fundamental underpinning of bringing us back, we're in stage 3 now. Literally, 99% of companies can open up, and that's a good thing. But this is all under the auspices. People need to change their behavior. You know, the fact that I go somewhere and can't shake hands, almost a foreign, totally foreign behavior, that we get to wear these handy dandy little things wherever we go, is foreign. But I got to tell you that, and Director Jeppesen and I talk about this, the response of the people of Idaho has been incredible. That they, you know, we never arrested anybody for anything. The people stayed home based on science, based on it was the right thing to do. And businesses closed based on the right thing to do. I think there was one arrest in Boise, maybe one somewhere else, of somebody violating the stay-home order, and it was a bunch of kids having a beer party, and they cited them for that, along with everything else. But the bulk of what's taken place have been people doing the right thing. And now, as the weather gets better, as things open up, it's going to be a little more challenging. But you know, some of the things that have happened is the federal government sent all the small states $1.2 billion, and Alex Adams, our budget director, is here with me. Alex and a group of people have been giving us advice and counsel on that. We are leading the nation in new and innovative ways to deploy that capital. Originally, our small business grants were small businesses 1 to 19. Today it's open 19 to 49 or 1 to 49. And then we just started last week with sole proprietors. We're going to announce soon even a different program. That program initially was set to pick up the people that fell through the gaps that didn't get the federal small business PPP loans or other employment benefits that were available. Let me talk a little bit about employment. I'm incredibly disappointed with how our system's working. Again, misery loves company. When I talked to other governors, I brought this up on a call and they just all chimed in. They were, there's a few of them that have changed their system and are getting those resources out at a better rate than we are. We're putting in a new call center. We've added employees. We've added capacity. We've added phone lines. We brought in private consultants, and we're getting there, but not at the rate of speed I would like to see. But and on the COVID side, and Dave can talk about that. You know, our basic #1 goal is to maintain healthcare capacity. If something happens, it seems like a long time ago, but it wasn't that long ago when Blaine County and even the Magic Valley was out of healthcare capacity. We were lucky that we had a system that had connections in Blaine County with the Magic Valley and the Boise Valley, but that is what everybody is worried about in every state, every country, that we maintain that healthcare capacity. There's a reason this is called the novel coronavirus. We're learning about it every day. Director Jeppesen chairs my coronavirus working group. And some of the things I was exposed in their early discussions are things that at the national level they talked about months later than the exposure that we got from Dr. Hahn and Carolyn Bridges, who serves as a volunteer on that. But for those of you who don't know, Dr. Bridges spent her whole life at CDC, and she's a Boise girl that happened to retire home, and we were very lucky to have her. So the only thing I will wrap up, and because I want to answer questions and let Dave talk, is I believe when I get asked by people that regardless of what happens, you know, if there was a miracle therapeutic tomorrow, if there was a vaccine that was in the pipeline, if there was cheaper, more affordable home testing, regardless of all that, I think what we've done in Idaho is as this global and national and regional economy turns around, we're going to be in as good a shape as Idaho is any place. We've got our pension fund, our unemployment fund, our rainy day funds. We've got all of those in a good condition. Some of the states are talking about a 20, 30, and even 40% reduction. We have conservatively planned for 14%. If you want to know more about that, Director Adams is here in the room and he can go on. But I want to leave your viewers with that optimistic note that it's the old two guys in the woods and the grizzly bear showed up, and one of them started to put on his tennis shoes and says, "You can't outrun that bear." It says, "I don't have to, I just have to outrun you." I will tell you in Idaho, we're going to outrun the grizzly bear better than anybody else.
I love the metaphor, Governor. You know, we just as a side note, as Blue Cross and Blue Shield CEOs across the country, we've been meeting weekly, obviously through this crisis, telephonically. And it has become clear to me, even in those conversations, that the experience here in Idaho is quite different than many of the states across the country whose economy is more dramatically affected than even our economy. It's hard on the folks who have lost their jobs. There will be impacts to the state budget. We understand that. But I think the fiscal conservative nature of our state, the ability to save for a rainy day fund and accrue that, the ability to, the desire, quite frankly, to balance our budget and spend within our means, has set us up for success coming out of this. And even if you look at some of the prognosticators, which, you know, you give, they're probably worth a dime or so, but the prognosticators will keep telling you that Boise and other cities like Boise particularly are poised to come out of this as strong as they were going into it, so long as we maintain a pretty prudent and thoughtful approach to reopening, which I think is exactly what you're doing. Governor, there have been a couple questions, and Director Jeppesen, I'm going to flip over to you in just a minute or two, but I want to double click on a few things that the governor said. You know, one thing that is on the minds of folks we've learned that we serve, and it's intrinsically tied to business and the economy, is schools and school reopenings in the fall, or the thoughts about schools and school reopenings. Now, I know that that's a collaborative decision of lots of folks, not just the governor's office, but, you know, there are a lot of folks, myself included. I have a 13-year-old and an 11-year-old at home. By the way, coming into the office today to do this webinar is like a huge relief for me, to get out of the house for a few minutes. And I'm sure a lot of folks feel the exact same way of trying to balance home life along with their professional life. And so there's still some angst and anxiety in the state, and I'm sure elsewhere, around thoughts around school into the fall. And I'm not asking you necessarily to look into your crystal ball, because I know it's not always clear right now, but just maybe thoughts around how you see school reopenings and maybe the steps that parents, families, employers, and the government will have to take to potentially reopen safely.
Sean, on the higher ed side, all the institutions have already made the commitment that they're going to open this fall. Now, they've got a lot of options that the K-12 system doesn't have. But we have such a diverse public education system in Idaho that the solution in not only one school district, but one building looks different than it does in another building. So it's a little hard for us, whether it's myself, the state board, or the superintendent, to say this is the solution that's going to address everything. And just like business, there's a high risk premium in everything we do until we get more certainty about the COVID virus. If we'd happen to have a big run, that will create more risk. But our intent is for all the schools to open up this fall. You know, opening times may rotate. Classroom density may rotate. People with underlying health conditions or older teachers, their exposure may be different. And so you have to take all those variables, and then we are open in the state. We're going to be in stage 4, we hope, knock on wood, here in a week and a half, with any luck. But then we will probably look at the state on a regional basis. As long as I got enough PPE and hospital capacity statewide where I'm not worried about that, we will probably react more regional, and quite a few of the other states are doing that. So that means that some of the counties where we don't have a lab confirmed case, I wouldn't go so far as to say there isn't, and Dave can talk about that. You know, they're going to have the opportunity to have more traditional school, but if you're in an area where we've got continued community spread, things are going to look different. But our goal is to have all the schools open this fall. But just like business, there's a risk premium given, because as a business owner, manager, leader, you can only control what you can control. And if your customers, your neighbors, your community happens to have a little bit of a wreck, you've got to embed that into your plan. But our goal is to open it up. I just want to add on to that what's taken place the last 80 days, just like any good organization, Sean, it's all about the team you put around me. I am so thankful that I had a year in this job before this happened. My comfort level with the 3 people in this room, I got Sarah Stover, my head policy person on healthcare. I've got Director Jeppesen, who runs health and welfare and chairs the coronavirus working group, and I've got Alex Adams. And every day, my staff amazes me about basically the options that are in front of me. That I think Jack Kennedy said during the Cuban Missile Crisis that at a time of crisis, sometimes the options are bad and worse, and making an order to have people stay home was a bad one, but the no action alternative was worse. And the no action alternative and even delaying the action would have been worse. We were one of the last states with a confirmed case, and we were one of the first states, and I'm proud of this, with a 4-stage plan that we had on the drawing board before CDC and the White House even recommended it. So yeah, that's where we are now, Sean.
Yeah. You know, one of the silver linings, Governor, that's come out of this has been the increased utilization of telehealth. We've seen it in our data as a company. We saw our claims skyrocket on the telehealth platform as we mobilized and expanded that resource to our customers. You know, and interestingly, as we dug out through the data, and we're still learning, right, as we go about the data, the vast majority of new utilization was behavioral and mental health within the telehealth platform. You know, and I think about ways we're having this conversation as a management team here at the company around how do we continue to support going into the future when COVID is behind us, the expanded platform that is telehealth to our customers. How do we make it more consumer friendly and convenient for people to be comfortable on that platform? But particularly in Idaho is how do we serve rural populations who do not have the same access to primary care, mental health, or behavioral health specialists in other parts of the state? This can provide a tremendous platform for that. So that's a space that, you know, that to your point about Jack Kennedy, there are some good choices, some bad choices, and some worse choices, and sometimes we don't get the good. And I think a silver lining for us has been, I don't think we're ever going back to a day where our customers and us as an organization aren't providing that platform to folks. And so I think the opportunity for government and business to collaborate on telehealth capacity, rural broadband capacity, and even some of the old rules and regulations that existed around provider credentialing and out-of-state credentialing. I mean, these are things we're talking about too, and I'm guessing you guys are as well.
Alex, not only my budget chief, but my kind of rules are, when you said that, I was smiling. But you know, it wasn't very long ago, 3 or 4 years ago, some of the national rankings had telehealth in Idaho ranked pretty low. But we had started to put some things in place, and this pandemic just put them all on steroids, whether it's telehealth, whether it's education, whether it's how we deliver government services, and whether it's businesses. That is going to be a legacy of this virus that's going to live on. And I think that, I know that's a great thing, particularly telehealth, because, you know, we've always recognized this deficiency we had in rural remote hospitals, in basically healthcare deserts in Idaho. Here in the Treasure Valley where I sit right now, and we've got kind of a healthcare oasis. So much Idaho is a healthcare desert, and the best way to pipeline water out onto that desert is through telehealth. I was up at Kootenai Medical Center, and I remember they were talking about having a neurologist have to drive to Monter's Ferry because they couldn't get compensated for it before. Your industry had already addressed that before this happened.
Yeah.
Director Jeppesen, his authority on Medicare and Medicaid, but we were making pretty good progress, and it's just been really good since then. And of course, I was hoping at this time a year that we would be, I would be touting the our three branch behavioral health plan that we have: judiciary, the legislative, and the executive. Unfortunately, we've been a little busy, but when we get a little more air in the room, we'll be able to work on that. But that delivery of mental health and you know what, to my knowledge, everything I hear is that that people, even some of the skeptics of it, are saying our ability to deliver behavioral health remotely has been a big success.
Yeah, we have on the Regions Blue Shield of Idaho board, Governor, we have a number of providers and physicians who have embraced it and had that same point of view, which is, you know, sort of a reluctant adopter before, now forced to use it today, and are now saying, no, we're not just begrudgingly coming along, we get it. We think we're going to expand our ability to do this even in a primary care setting for the small independent physicians throughout the state, which in many of our smaller communities are really the primary go-to for healthcare. Governor, with that, I'm going to pivot to Director Jeppesen for a minute. Director, you have been in the trenches, digging with a shovel from day one on this work, and your leadership on the task force. You've just been, I have to say, I mean, even on the calls I've been on where you've been involved or briefing folks, your level of familiarity and attention to detail, and your very, I think, methodical, even-keeled approach to this has been a very good thing for the state. So if you wouldn't mind, maybe if you could give a little preface to where we're at today in your mind, particularly in our reopening plan, and then I want to hit some questions that have come in from folks who really around testing, both the diagnostic testing as well as the antibody testing, and there's been a lot of some well-intentioned and some misinformed early messaging around testing, and I think the testing committee has come out and provided really clear definition around what is appropriate and what is medically necessary at this point. So I think our employers need to navigate that. I think they'll benefit from hearing that from you as they navigate their own choices about how to reopen.
Great, Sean. Thank you for that very generous and kind introduction. I appreciate that. The working group has been meeting now since the end of February, actually. So a little over 3 months here, right around 3 months. And our long-term game, obviously, and the governor mentioned this, is to have a vaccine or a therapeutic, or to achieve some level of population, or sometimes called herd immunity. Those things are down the road, and so what we've been focused on at the working group level is how we work closely, obviously, with the governor on the stage reopening plan, and then specifically in the working group is what do we need to do in the meantime to make sure we can support that plan and support businesses, frankly, to stay open while protecting people at the same time and helping people have confidence to return. And there are really three key things that deliver that. Two of them are testing, which I'll come back and answer some questions about, and contact tracing. When you have community spread, it's really hard to know where the disease is. And with increased testing and contact tracing, which allows us, the department, to go out and identify who an infected person has been in contact with. Actually, it's not through the health districts, I should be clear. To where those are, it allows us to be much more precise. And as we continue to open, a lot of focus has been on increasing testing capacity. And testing capacity alone is not enough. You must have, in addition to that, the ability to then contact trace who those individuals have been in contact with, as well as some rapid response where we know we have a concentrated outbreak to test everyone in that situation. So that's been a focus for us. I'm happy to give some details on that, but we continue to focus on that. I will just say that when we started this journey, contact tracing has been around for over 100 years. It's a very standard tool in the toolbox for how you trace things that happens today. If somebody has tuberculosis, I think we had a foodborne illness that happened here in the Treasure Valley about a year ago. Contact tracing was employed to see who all might have been in contact or around that individual. But we had 23 trained contact tracers in the States 80 days ago. That quickly got stretched to its absolute max as we went through the month of March. And we went on a path to train both internal folks as well as hiring some limited service folks to help us with contact tracing and lots of volunteers, frankly. And today we had a goal by the end of the month of having 250 contact tracers trained and ready to go, and we've achieved that. We're going to continue. We want to get to 500, which is what all the models say the surge capacity is, but we've really gone from 23 to 250 here in just a very short period of time. I'll come back and talk about testing here in just a minute, it sounds like, so I'll leave that open for a second. But the last lever, and that's where I really want to just compliment and ask for the continued help of all the folks on this call and all the folks that you represent in your businesses, is the importance of physical distancing and face coverings while you're out in public. The data becomes clearer and clearer and clearer that the best tool we have in our toolbox is that physical distancing, wear a face covering if you're out, and can't physical distance. And you know, I could go down the list, but you all know the list. Wash your hands, if you're sick, stay home, all those things. And the data, I've seen multiple studies in the last 2 weeks that say by far and away that's our best lever we have. So we continue to push that at the working group level as well. So Sean, that's a little bit of intro where we are. That's led us to be here in stage 3. The data looks good. People over fixate a little bit on cases, including myself, so I get caught in that trap. But what we really look at is not only the cases, which tells us how prevalent the disease is in the communities that are here in Idaho, but in conjunction, how many of those cases are headed to the hospital, and then how much hospital capacity do we have. And I'm happy to report that on both of those measures, we continue to look very good in the state of Idaho. Our hospital capacity looks really strong right now, knock on wood, and the number of COVID cases that are showing up that need to be hospitalized remains very low. So the good work is paying off, and we hope it continues as we head towards stage 4. So Sean, I'll hand it back to you, Sean.
Yeah, Director, actually a question just came in that I think is a good follow-on to what you finished with, which is being a little more specific on where the curve is at this point. How has it leveled off? You indicated the data looks good for reopening, and my guess would be is things have leveled off as we'd expect, but I think people are curious for the real live answer from you.
Well, that's my real live answer. The one that tends to get people's attention, including my own, is an increase in cases. We expect that to happen as we have more testing that takes place. And so when we set that, we have 3 metrics. What's the disease burden in the population? That's number of cases and test positivity. Number of people showing up at the ER with COVID-like symptoms and getting admitted. That's the first indicator of hospital capacity, and then actual hospital capacity. And on that metric of cases, we actually purposely included a metric around number of cases, but we had 3 ORs, or 4 of the metrics that we can look at, because as the number of cases go up, those cases are out there anyway. We haven't been testing as much as we would like, and now we know about them. It hasn't really changed the situation with the hospital's capacity. So instead of just number of cases, which if we had a huge spike, that would be concerning. But we look at percent positivity of testing. And we're actually quite good there. When we went forward in stage 3, we were just below 4% for positivity. This is molecular or PCR testing, which is fantastic. Anything below 5% is great for us, or a declining trend if we're over 5% works for us as well. And at the moment, that actually is really looking pretty good. So I actually, again, no predictions. A lot could happen in the next 12 days here as we get ready for the stage 4. And it really comes down to the good people of Idaho and the good folks on this call. But at the moment, I feel really good about where we are.
Let's flip to testing, Director. So, and I'll provide maybe a bit of additional context for our audience. There was one question that came in. They had heard that tests are $100 and up. What tests needs to be done and how often, which I think is a really pragmatic question that a lot of business owners who aren't in the thick of the day-to-day are curious about, because they've heard so much or read so much literature, both on traditional media and social media, sometimes with kind of conflicting and confusing terms. And I've, we've all become experts now, of course, on antibody testing and PCP testing. I wonder if you wouldn't mind distinguishing between the two, and by virtue of how I'm setting up the question, I'm helping our audience distinguish between the two a bit, between diagnosing whether you have it currently, or antibody whether you may have had it, which quite frankly, the science is behind on in determining both whether the tests we have available today are accurate, and then on top of that, what the right clinical interpretation is for those tests when we get them. And I think employers have been given a lot of information about both, sometimes from folks looking to do tests. So maybe you could help distinguish and maybe clear the path a little bit for folks who are trying to make real common sense decisions.
Yeah, Sean, happy to do that. And I would just also point on the rebound.idaho.gov website, we have the full 36-page document, which if you start reading at 8 o'clock at night, you may not finish before you fall asleep. And we do have the short 2-page version, which does touch on this antibody versus molecular testing. So the full research and recommendation is out there. But let me just delineate the two for a minute. Molecular testing or PCR testing and antigen testing are in this category of testing whether somebody currently has the virus. And more importantly, if they have the virus, probably they're, in fact, we know they're contagious at that point. They're shedding virus or they can infect other people. And so that goes by several names: molecular, PCR, antigen testing. Antigen is just spinning up now, it hasn't quite hit the market. And that testing is really important in that it tests, is somebody sick right now? It's usually done with a nasal swab, which I understand is a little bit uncomfortable because it's an upper cavity nasal swab. But it allows us to then get that sample in and test whether the RNA of that virus is active in somebody's body. And that's the purpose of that test, is you're sick now and we know you have the coronavirus, and you have COVID-19, and thus can take appropriate precautions to self-isolate and stay home from work, all those sorts of things. The antibody testing is actually a test that there are some antibodies that get generated when somebody has the virus. And the antibody test is a test that is designed to measure whether somebody has the presence of those antibodies or not. And so let me kind of list what that test is good for or should be used for, and then what it should not be used for, to kind of go to the heart of Sean's comment here. So what antibody testing is good for is it does give us some picture as to how prevalent the disease has spread within a community. So like, for example, in Blaine County, there's a number of entities that are doing antibody testing up there, primarily as a public health approach to understand what was the actual prevalence rate in that community. And early data indicates it's a little iffy, but it's more than 1%, probably less than 10%, but there's more people that had it than got tested for the PCR or molecular testing. That's helpful for us to really understand the extent of the spread of the disease. In addition, that testing is helpful just to know to help up with the if those antibodies produce immunity, and I want to comment about that. It's helpful with some potential therapies down the road. So we know if somebody has an antibody, could that be used as some type of treatment down the road? Unproven, early science, there's some experiments going on with that right here in the Treasure Valley with St. Allison St. Luke's on that front. The thing that antibody testing is not good for is it's not good for telling somebody if they're sick right now or if they're shedding virus right now. So if somebody goes to get antibody tested and says they need to come back to work, and it says that, yep, you have the antibodies, that does not mean that they are not currently infecting people. And that to do that, that's a molecular test we need to do to make sure that that's the case. And then more importantly, there's not clear science that the presence of those antibodies, even though that is likely to mean that you've had the virus at some point, it's not clear that that means that you have immunity from getting it again, or how long that immunity or how strong that immunity may be. And so we hope that's the case. We really hope that that turns out to be true. But I've read a couple of studies lately, and I don't know if this is exception or rule, of reinfection of folks who've had the virus before. And so I can tell you, when I talk to people personally and have had the virus or have gotten an antibody test, sometimes they think that means they don't have to take precautions anymore. And we don't know that to be the case just yet. So for an employer looking for an antibody test for comfort that somebody's not going to be a carrier in their company, I don't think that brings the solace that you're looking for. That science may evolve. We may get to where that may be the case, but we're not there just yet. But antibody testing is important. It has a place to play mostly from a public health population overview look where things are at. So, Sean, hopefully that kind of lays out the difference between the two for you.
Yeah, no, it does. It does, Director. And you know, to your earlier point and the governor's earlier point, until there is a proven vaccine, the reality is that the best course of treatment right now for controlling the virus is distancing and simple health and safety, personal health and safety measures to contain the spread of the virus, which is interesting because there was another question that came in, and I'm actually going to read it verbatim and segue. And Governor, please feel free to jump in here as well if you'd like. My business has 25 employees who today are all working remotely and can continue to do that just fine. There's no rush to return everyone to the office until everything is deemed safe. What type of information should I wait for in order to know that it's time to go back to business as normal without managing the risk of COVID? Now, I will provide maybe a bit of air cover on this question, which is there's probably never going to be a day, and I'm saying this as the CEO of a health insurance company, where we aren't managing some level of risk of COVID for the person who submitted that question. Just like there is never going to be a day that we're probably not going to be managing the outbreak of seasonal flu in the fall. These are naturally occurring viruses today that we don't have a vaccine for in the way that we do a flu vaccine that many people get shots for in the seasonal flu cycle. And so while I understand the desire for clarity and certainty, just maybe preface it with, we're always going to be managing some level of this risk, but I wonder, both of you, how you would answer that question for an employer who actually is working remotely and doing just fine.
Well, they're very fortunate because a lot of the companies that are having problems just have there's a real practical issue about remote work. But as I said earlier, we're learning a lot more about that. But there's really, you know, ideally a vaccine delivered, and it might be a 2-dose vaccine, it might be a 3, but I think most think it might be a 2. And, you know, we got 330 million people in the United States. You got to have 80–90% of them. And then you got the world population. So the ultimate magic bullet of a vaccine is really out there. Now, there's going to be therapeutics. There's some being developed now. We've actually got some that we have received from the federal government that we distribute around in Idaho that have limited help. It basically shortens the time that you're sick. It's not a panacea, but there's lots of them being developed. I think one of the problems with the testing is there's a saliva test, there's a less intrusive swab. All of those have kind of precluded people with lots of capital from diving in to some of these existing testing, because there might be another one that comes along that's a lot cheaper. And that's maybe kept governments, businesses from diving in, because those other ones are in the queue. There's some of them being used here in Idaho right now, and there's a lot of research on the saliva test. When I look at going back to school, your question, Sean, if we had a affordable saliva test, that would make going back to school much easier. You know, we could do it originally with the staff and the students, and then if we start to have a problem somewhere, and then of course, one of the things we didn't talk about is Dave and I usually have our graph, which is Farge curve that we started out with, which is the one with the big curve that we never even got close to, and then the little curve that, other than the Wood River Valley, we didn't exceed our healthcare capacity. But one of the things that I was actually making a list while I was listening to Director Jeppesen, Telehealth is part of what we're doing to increase the healthcare capacity curve. What we've done in the rules, what we've done about allowing former people that were in the healthcare field, what we're doing about pulling ahead physicians, assistants, and nurse practitioners, what we're doing as far as surge capacity for ICU, for ventilators every day, because some of these other states were learning how to more efficiently use ventilators. That's all increasing the red line, which is healthcare capacity, and that will make a difference about what people don't want to go is they don't want to go get exposed, and it may not be them. They may be a young, very healthy person, but they may go home and be exposed to their parents or a friend or a child with an immune compromised system. And so we have to have lots of healthcare capacity. And that's, if your workforce is 25, don't have, older people they associate with, don't have compromised healthcare people, that's different. But we know that of all the adults in Idaho, almost a third of them fall into that criteria. They're either old, they've got asthma, they've got diabetes, they've got some other health condition, and that's part of the problem with calling people back to work.
Yeah, the virus seems to pick on pre-existing conditions, quite frankly, and I think that's the part we've tried to educate folks on, is you may not have the virus yourself and so feel completely free to walk without taking any safety measures, but it's really the people you're coming in contact with that you're compromising. And so in the spirit of neighbor helping neighbor, this isn't just about me. This is about the people that come into my life and try to serve them in the same way.
I started attending Dave's coronavirus working group, and we started talking about masks. Then there was a discussion about, is it aerosol, is it droplet, and Dave talked about the research. The research is really quite encouraging about the ability of these little things right here to stop the spread. That's actually been part of the novel coronavirus research that's been coming in that's been quite helpful.
One of the, flipping to the economy for a second now and trying to balance this health of people and the healthy economy, one of the questions that's come in is one we've heard a lot, and I know both the federal government, state government are wrestling with this as well, which is employer liability. So a lot of businesses are trying to, navigate this the right way. But they also acknowledge that when they make a declaration about how they're testing or how they're bringing back folks to work, it opens them up to potentially being wrong or having some sort of suit brought against them, and their liability is exposed. Even if they're trying to do everything right and everything as the science as we know it today, some point in the future, they're opening themselves up to future litigation. So I'm curious on that front. And you don't have to speak to the federal work being done as much as, is there a conversation going on within state government about what we as Idaho can do on that front in cooperation with the federal government to try to protect employers? I think that will give them also a sense of confidence as we work on consumer confidence, employer confidence as well.
Yes, quite a bit of discussion. The Senate, our Senate delegation, and you've heard Leader McConnell talk about it, that's as they negotiate the Corona package 4.0, I guess, 3 or 4.0, the Senate leadership said that's imperative. Now, whether it gets in there or not, just from the very beginning, and your businesses that you talk to that operate in other states, our tort laws in Idaho are much, and our system is much, you have much less exposure in Idaho than you would in another state. The there's been quite a bit of talk about it. I have not seen a specific proposal, but we're open to it, and we're talking about it here in this office, and that will continue going forward. I don't think you can do I don't know that it'd stand up in court if you gave a categorical exemption that it maybe would stand. Well, A, it would take the legislature to do it, and B, it was categorical. I think there would probably be a court challenge. So it would have to be surgical, that we carved it out, that if you're following the best practices, you're protected. And then, of course, the issue with the darn COVID virus is, given the asymptomatic spread, the burden of proof to prove where you got it is a very high hurdle to get over. Very
much so. Director Jeppesen, one of the questions that's come in is, and it's a really practical question, from a business leader here. We're spending a lot of money right now on services to disinfect our offices in order to allow employees and the public access to these offices of some level of comfort that they are clean. Are these disinfecting services effective, and how often should it be occurring?
Yeah, Sean, that's a great question. CDC guidance has, the science has evolved on this topic quite a bit. I think when we first started this, there was some speculation about how long the virus could live on surfaces. That has continued to be refined and tested, and that continues to evolve. But all of that says that, yes, there is some level of potential risk on highly used surfaces, doorknobs, that sort of things, that the virus can live on that surface for some period of time and get picked up by somebody that touches that. So there does continue to be a need for disinfectant and cleaning of high-touch surfaces. And in general, that's just, I think, good practice, frankly, because whether it's the flu or cold or coronavirus, that's where a lot of those things can get transmitted. But CDC does continue to recommend, and all the guidance that I've seen, and it continues to be in all the guidance that the state has given, both in general practice as well as specific industries, that regular cleaning and sanitizing of frequently touched surfaces is pretty important. Not just to give confidence, which it definitely has that benefit, but legitimately the current science says that's a safety precaution that needs to stay in place. And so, yeah, it's something that's pretty important. And I would just point to CDC guidance or the guidance on the rebound.idaho.gov website for specific industries.
Yeah, thank you, Director. One other question, a technical question on false positives on these antibody tests. So one business owner is curious to know if the newer tests are showing any promise of getting better, because early tests of these antibody tests, as we've talked about, kind of clinical interpretation as well as use of these tests, there was also a high false positive rate on many of these tests. Do you see it getting any better in the future?
Well, yeah, and I want Dave to answer, but I know people that had the PCR test and it wasn't accurate.
Yeah, yeah.
They definitely have some level of accuracy with all of that. On the antibody tests, we are seeing that there's sensitivity and specificity, and I sometimes get these two mixed up, but I believe sensitivity is the ability to detect the presence of the disease. And specificity is the ability to be accurate when you don't have the disease, to get a true negative. And we have seen that sensitivity and specificity have increased on antibody tests over the past month or so, and into fairly high levels. The problem is that, particularly on antibody testing, the third factor is the prevalence in the community. And when you have a very low prevalence of the disease in the community, even with high sensitivity, which is measuring whether you have those antibodies or not, you can get a lot of false positives. And in fact, the data is have a 1% prevalence rate in the community, and then you have a high sensitivity and specificity, high 90s sensitivity and specificity, you can still have upwards of a 50% false positive rate. And that's just because it's so hard to detect in that low prevalence situation. And so on the antibody testing, if it's negative, you can feel pretty confident that you don't actually have the antibodies. If you get a positive, what the CDC is actually recommending is that you then take a second test because 2 serial tests increase the probability if you've got a true positive. And then, of course, if you got a positive and a negative, then you're probably going to need to take a third one to sort of figure out where you actually are. So that continues to be, the sensitivity and specificity of the tests are increasing and doing quite well. The low prevalence is what's driving a lot of false positives right now.
Yeah, excellent. Listen, we have time for kind of one question, which I actually don't want to turn into a question. Well, actually, I'll ask it as a question, but it allows you to give us as a business community, as your partner, some sense of insight into what we can do differently, more, continue doing, not do, in order to support the efforts you've made to try to move us through this. If you could wave your magic wand today, besides getting rid of COVID, which I'm sure that would be your #1 magic wish, what can we do to help you as your partner with government?
Well, as we said a couple times here, mask wearing is, people staying home if they're sick. That's probably the #1. That will really add to our confidence about we're doing the right thing to preserve healthcare capacity and allow people to get back to work. But we want people to get back to work. We want that to take place. So that is very important to us. But all those things, hygiene and mask wearing, is probably the most important.
Yeah. Sometimes the best solution is the simplest solution in this case right now. And I know we join you and all of the health payers and healthcare industry in general in trying to help those we serve do just that. I want to thank you both. We are up on our time. It goes quickly. I want to thank you for joining us, for your expertise, for your commitment to your partnership over these last couple of months. I, for one, selfishly, am really excited about school reopening in the fall. So I want you to know you have a partner in business here to make sure the school's open on time and safely. I don't know my 13-year-old and 11-year-old agree with me, but that's really not their opinion to have right now. We will do everything we can on that front because I do believe that is a business and economy issue and the workforce issue of getting schools reopened safely as well, and we're your partner in that, as well as telehealth going forward, particularly rural access to telehealth and the mental health capacity of the system. Thank you guys. I really appreciate you spending the time with us, a whole hour. I know you have more to get on to, so thank you so much. And thank you all who've joined today. We really appreciate your questions, your engagement, and for continuing to partner with us throughout the state. Have a great day, everyone.